Going live to me. Okay, I am live. Before you enroll, the Medicare decision that could cost you thousands. Could cost you thousands. I've got my Medicare and You 2025 booklet here, and this is what is sent out to every person that goes on Medicare, that has Medicare Part A and B. You have a choice, and this is on page, let me see, it's page 10. I've got to be able to read, so I've got to take my glasses off. Original Medicare, you have Part A, which is for the hospital, Part B is for the doctors, and then you would have to add a Part D, which is your drug plan. You can add it. If you don't add it, you could be penalized. You will be penalized. Don't take it for granted. You can also add a supplement plan. They come in plans A through D, F, G. Well, F is a caveat. You're just turning, if you turn 65 after January 1st, 2020, you cannot get a plan F. Okay, just let me say that. But F, G, K, L, M, N. Not every company sells all of the plans. Typically speaking, right now, the plan that is the most popular is either the Plan G or the Plan N. I personally, they also have a high deductible plan F and G as well. So anyhow, these are what you have to make decisions about, whether you want to stay on original Medicare or go to the Medicare Advantage. The Medicare Advantage is a Medicare approved plan from a private company that offers an alternative to original Medicare. It has Part A, Part B, and Part D is most of the time included. But it also has some extra benefits. They're not all the same. They're different on each plan, and they don't have to offer. Just to give you an example, they have plans that have a gym membership that they will give you. They have dental benefits. They have eyeglasses that they will pay a certain amount of money on. And some of them even have a food card, or you can use it to pay different things. And sometimes you have to qualify in a certain way to get that benefit. But you'll see a lot of times on the television, you'll see all the time where they have a grandmother saying, "Hey, you can get this food card, and you can get your groceries, you can get this and that." You just have to make sure that a lot of times, the food card is for those that are on both Medicare and Medicaid. Those are two separate programs, and not everybody that is eligible for Medicare, you have to qualify with being your income low enough to qualify for Medicaid and special help. So that is the difference. Now, most of the time, the Medicare Advantage does include the drug plan. A lot of times, now, let me just give you an example. I was looking up for an individual who is in Oregon. You can get a Medicare supplement and a drug plan with it varies according to which plan is available in your state, which company has what plan available to you. So that's where you need a professional to go through what is available to you, for you, and see which plan you might even like. But most of the Medicare Advantage plans have no upfront premium that you have. but you're going to have to pay on the back end. You either pay up front with a premium with a Medicare supplement. Some people only have the original Medicare, and you are risking a lot if you just have original Medicare. You would at least need to get a Part D plan, or if you wanted to get it later on, you would be penalized because you didn't take it when you were supposed to take it. I hope that makes sense to you. I mean, does anything the government does make sense? No. Plan, don't mean it. But these are the things that you have to worry about. Part A is for the hospital, Part B is for the doctors. There are deductibles, and you can go through your book, your Medicare book, and it tells you various. Now, I will say this. I've been dealing with Medicare since 1997, so I've seen the changes. They brought the Medicare Advantage plans in around in my. They did testing before that, but they put it into law, the Part D and all that, in 2005. And so, of course, if you you can be penalized on your Part B premium as well. I don't know if you know that or not. If you try to get the Part B when you should have got it. That's why it's important to talk to a professional. I heard a commercial the other day saying, "Oh, go to the source, go to Medicare.gov." Well, they can tell you some things, but they may not tell you. It's like AI. Anything that you put in, you can get out, but sometimes an experienced agent can help you navigate through the process. Okay? So anyhow, that is exactly paper. Now let's go over this. Some of the major things that you need to be aware of is with original Medicare. Glasses on. Of course, it says you can join a drug plan and be able to choose between different companies. You can use any doctor. I'm reading verbatim out of this booklet. You can use any doctor or hospital that takes Medicare anywhere in the U.S. One of the major differences between the original Medicare, and let me just say this. If Medicare does not pay on something, typically your supplement will not pay on it. As long as Medicare pays on a particular thing, then your supplement will pay for it. And it will pay according to which plan that you got. Okay? So, you can also shop for and buy supplement coverage that helps pay your out-of-pocket expenses. And they can be expensive with, especially if you happen to go into the hospital several times, it can be very expensive. But the major difference, I'm going to be honest with you. If you're healthy, don't take a lot of medication or whatever, you may want to look at a Medicare Advantage because there's no premium on the other. And they do have some of these other benefits like dental benefits, eyeglasses, and gym memberships. A lot of them will have certain benefits like that, and because they want to keep you healthy. Medicare has no incentive to keep you healthy, okay? They really don't. But you can use the original Medicare anywhere in the U.S. without any restrictions as long as somebody accepts Medicare. And most doctors and most hospitals do accept Medicare. The Medicare Advantage, you have to stay within a network. There's two different types of networks, either a PPO, which is less restrictive, or an HMO, which is, if you have an HMO, Medicare Advantage, and you happen to go to a doctor that is not covered in the network, then you are responsible for that whole entire bill. So that's where you have to be careful. I prefer PPO networks because it gives you, even though it's more expensive, if you have a PPO that you go out of network, at least it gives you the option to be able to go out of network. And they do cap it. One of the reasons why I prefer a Medicare Advantage over just having original Medicare is because with original Medicare, there is no cap. It is, you can pay 20% of whatever the bill is on year after year. I mean, well, whatever it is for that entire year, 20% you could be responsible for. With the Medicare Advantage, they put a cap on it for this year. It depends, okay? It depends on your. Now, Medicare Advantage is very much dependent on where you live, what plans are available that you may have, what the competition is like in your area, whether your doctor is in the network. And hospital is in the network. Those are very important things. But a lot of times they have other benefits that, and like I said, the cap is important. Let's say they have, I was looking up for Oregon, and somebody had told me about the Kaiser. I'm in North Carolina, but I also have a license in Oregon. So I was talking to the guy. He had talked about Kaiser Permanente. They have an HMO, POS, that has a maximum. It has to be in network, so all the doctors that are in their particular network, they have a cap that you're not going to pay more than $5,000 in one particular year. The thing about the Medicare Advantage is they also, Part D does this as well. These plans, either Part D or the Part C, the Medicare Advantage or the drug plan, they always change year to year, and it is very important. And we're coming up on a season that you can go and look at your plan and change. And they give you a restricted time of year that you can be in, that you can change the plan. So you need to do that each year, because they may have a drug that's, the Medicare Advantage may have a drug, or the PDP as well. They may have a drug that they cover this year, but they're taking it off, or they're moving it around in the different tiers. So that's why it is so very important that you check on that each and every year. So I just wanted to bring this to you to give you a good example of what original Medicare and what Medicare Advantage. Somebody put in one of my videos, they made a comment and they said, "Oh, so it looks like you recommend a Medicare Advantage." No, I help you make the decision. I'm not going to be paying your premium, and I'm not going to be paying your bills. I can guide you, and I can help you to understand which is which, and then you ultimately have to take the responsibility to make your own decision. And I will, within that decision, help you find the best for your situation. That's what I'm here for. Some people say, "Oh, I sell Medicare supplements, and I sell Medicare Advantage, and I sell Part D plans." What my job is to help you to understand so that you can come to terms with what you would like to do. That's what my job is. I need to understand who your doctors are. I need to understand, are you flexible? What's more important to you, paying that premium, having the network, the unlimited amount of people that you can see with original Medicare? Or are you okay with the Medicare Advantage because you want the dental benefits? Those are things that you have. Now, look, I also sell dental insurance if you want that too, but that would have an additional cost with the supplement plan. You would have an additional premium that you would have to pay. But I have that too. So if that's something of interest to you, you can get that too. But all I'm trying to say is this should guide you and help you. there are people out there. There's Zoe, my dog. She doesn't know I'm doing a live, so she's barking. She saw something. Tim, my husband's calming her down. But anyhow, where was I even going? Boom, can't remember. Zoe, you got me off track. You are going to ultimately have to make a decision which way you want to go. But I will help guide you and give you the best advice where you are at. That's where I was going to go. If you have limited funds, you're not independently wealthy. And let me say this. There's either two types of people on the Medicare Advantage. Well, three, I guess. There's the individual who they really can't afford a Medicare supplement premium, even though I don't necessarily agree with that, because you can get a high deductible Plan G. You can, and they're not that expensive. You just need to know how it works and what your total responsibility. Because I told you Kaiser Permanente on the Medicare, it was an HMO POS, had a maximum out-of-pocket of $5,000. It's way less than that to have a high deductible Plan G. Way less. Now, maybe $20 or $30 a month, and that to me is not that expensive. I shouldn't say 20. It's probably 30 to 40, 30 to 45, something like that. Now, that high deductible does not include the drug plan or the eyeglasses or the hearing benefits or some of the other things that the Medicare Advantage has. So I can see how some people would say, okay, I would rather have the Medicare Advantage and get all of that and not have to pay any additional premium other than my Part B premium. There are plans in some states, I will say for North Carolina, because that's what I'm used to and familiar with. In North Carolina, we have plans with Medicare Advantage that will pay a portion of your Part B premium. So if you are rich, if you have a lot of money and $10,000 is not that big of a deal for you, because it's going to be capped at whatever the maximum is, then you may want to get that and get your some of your Part B premium paid for. So those are things that I guide you and tell you about so that you can make the proper decision. Now, all day long, people say, oh, I would love to have a Medicare Advantage because I don't want to pay the premium or any additional premium, because it could be from anywhere from $150 to $200. I told you about the high deductible plans, but a regular Plan G may cost you, $100 to $200. It depends on your age. It depends on which plan you get, okay? But you want the flexibility. You want to know that, okay, as long as they accept Medicare, I can go anywhere in the United States without any problems. I can have my health care needs met anywhere. So that, I hope that's not clear as mud, and I hope it has helped you some. But I'm just telling you, with original Medicare, and you don't get a supplement, you could be on the hook for a lot of money if you have something that happens, that you have, like some type of cancer that you're going through. Chemotherapy is an expensive, thing that happens. It's expensive, I know. Went through it. So I'm not on Medicare, though. But I'm just saying, it depends. You can, but a lot of people absolutely love the benefits with Medicare Advantage because it's a cap on the maximum out-of-pocket that you would have to spend every year. Now, the other thing about the Medicare Advantage is you can have a Medicare Advantage that is great this year, and then next year you have to change and go through change a lot through the time that you're on Medicare. So It depends, and you're going to have to look at that regardless, whether you have a Part D, a drug plan, or the Medicare Advantage. You need to go through that each and every year. But you will possibly have to change, and a lot of people, when they get older, they don't like change. But I'm just saying, there are things that you don't have to worry about with original Medicare, and you do have to add these, and these cost money, and people don't like to pay sometimes. But it depends on your particular situation. I can show you how you can pay for this, and it not be such a major problem for you. I can show you how to do that. Those are some of the things that I do professionally. I'm not going to tell you right now here because you need to contact me. In the description, you can contact me. You can go to my website. You can call me. But I'm telling you, the Medicare Advantage, a lot of people like these plans because they have everything included in one plan, and as long as you're healthy, then a lot of people like it. Just telling you, it's not my decision, it's your decision. My part is to try to help you navigate so that you can go through it. But so you would have your original Medicare, and then you would have your prescription drug plan, so that may be another card that you have. And then you have a supplement plan, and that's another card that you have. So a lot of people like the convenience, and they do love some of the advantages. And it depends on I can't say what yours is unless you tell me your zip code and, your zip code. Give me your zip code and I can show you what you can possibly have. And then I might need to know a little bit more information about you, whether or not you could qualify for some of the other plans. A lot of plans are going to have conditions, like if you have diabetes or high blood pressure, congestive heart failure, some of those type of things, that they would have a special type of Medicare Advantage that you could get into. A lot of times, the other thing is, with a supplement, you can change your supplement as long as you can qualify with your health any time of the year. Your prescription drug plan and the Part C, they're locked in for 1 year at a time. And there's special times that you have to look at this. That's why you see all the commercials come, because it starts October 15th and goes to December the 7th. That's the annual enrollment period that you can do as many changes as you want, but on the 7th, the last time that you make your decision, that's what you're locked into. There are a little bit of exceptions, but that's where you would need to talk to someone like me if you want to see if you might qualify for some type of exception. But you're locked in with the Medicare Advantage, and like I said, they're not necessarily always going to have particular plans that will be the same. They're never the same. These plans are never the same. Let me just be honest with you. The supplements change every year too, because every single year, Medicare changes. They change every single year. So you have to, when they make you responsible for more on the hospital copay, the Part B deductible is $257 this year. Next year, I have no idea what it's going to be, but it's not going to be $247. I can guarantee you that. Or $257. Did I say $247? Because that's one of the times it was $247. It goes up each and every year, and then your supplement goes up in cost as well. So there you have it. No questions. Nobody's put anything in the chat that I can see. So basically, you're locking in with Medicare Advantage. There's restrictions that revolve around it, but there's benefits with it as well. The supplement, you get a supplement, you can change as long as you qualify with your health. So that is a major difference because there are no qualifying conditions with a Medicare Advantage. You don't have to qualify. It's the same as being on original Medicare because it replaces original Medicare. You can be as sick as you are with original Medicare. Same way with the Medicare Advantage. With a supplement, get a supplement plan, you have to qualify with your health after you have your, when you first turn 65 or you're first going on Part B, you have a window of time that there are no health questions and you can get any plan that you want. But after that, then they can, now listen, there's plenty of people with different situations that they can qualify for a different Medicare supplement at a later time. That's why there's lots of different companies and try to find, and every supplement is exactly the same. The major difference is the price. That's the major difference. They all have to cover exactly the same. Now the Medicare Advantage plans, they have to cover certain things, but they can add and subtract and make benefits richer in certain areas, trying to attract different things with different people. So it depends on what you have as your priority. Do you have priority of dental benefits? Is that a big, huge advantage for you? Is going to the gym a huge benefit for you? Some of them have it, some of them don't. That's how it works. With no questions, I'm going to wrap it up, and there you go. I'm Michelle Morar. You can contact me. Look at the description below. Give me a thumbs up if you enjoyed this. At least do that. Come on. At least give me a thumbs up. And I will see you next time.